We'll call meeting to order, whatever time it is. That's official. Look at what, anyone that watches, and they're all different. Approval of the December 15th minutes. Is there a second?
Second it.
So everybody read it? So. Good. They're all nodding. All in favor, say aye.
Aye.
Opposed, carried. Since we have a new person in the room, we will go around and introduce ourselves and what we're about.
Me? Okay, I'm Ashley Nelson. I, as of Monday, am the Health and Human Services Director. Nice to meet you.
I'm Kaylee Bugby. I'm the Public Health Officer.
I'm Phil Schneider, and I'm the county board person on this committee.
Bethany Gillian, Adult Services Social Worker.
And I'm Rich Green. I have been a youth justice worker here for the last 5 years. And on Monday, I started as the Children and Family Services Supervisor.
Leroy Hopesul. I started out as being the coordinator for 12-step AA work up in the jail, but since COVID, I haven't been up there. But I'm a citizen. Ladysmith District. And today is my last meeting. And I hope to pass it on to Kim if that would be applicable. So
Thank you for your time on the team, Leroy.
I tell you, folks, it's been enjoyable, it's been fun and informational, and it's been good here. It's been a good time. Thank you.
Welcome.
Kimberly Fitzgerald, I'm the Executive Director for the Lighthouse Shelters here in town and looking to join as replacing Leroy for the citizen position.
Welcome. I'm Chris Soltis. I'm the supervisor for adult services, 34 mental health AODA crisis response. Kind of have a lot of hats, but that's why we're here today, is to discuss behavioral health. Oh,
Good morning.
good morning. I wasn't sure if anybody else was on. Thank you.
Oh, yep.
Why don't you introduce
Go
yourself?
ahead and introduce yourself, Chris.
Oh, this is Chris from Macusa, one of the nurses. Chris Descharles.
Thank you.
The new stuff.
Okay, well, we kind of talked a little bit about some of the staffing changes as evidence in this room. So we've got obviously Kimberly here as a citizen advisor in Leroy's replacement. Ashley is representing the director position and will continue on this team. Rich, thank you for joining as the new Children and Family Services Supervisor. Other staffing changes within Health and Human Services. We have a new Children and Family IA worker, Heather, who came from our CCS department. So we had an opening in CCS, which we've just hired for. She will start on the 31st. Brenda Jones in Adult Services had retired on February 14th after 25 years with us. So Alicia took that position out of Children and Family. So kind of the trickle-down effect of retirements and staffing changes. So we're going through a lot of learning curves, and we're excited. Obviously, Jeremy retired. You guys all know that. Okay, new business, state audit. I always have that on a continuous rotation. We monitor for compliance, and every year we have an audit. Every other year it's a desk audit, and then on the opposite year it's an in-person. We do have that scheduled for 8th. So we will have our 34 audit. It's a new surveyor for the state of Wisconsin. I've never met her, so I'm kind of excited for that opportunity. And basically, when they come here, everything that we're discussing today is part of that audit. So it's subjected to the results are subjected to verbal recommendations all the way up to citable issues that according to statutory language. So you'll be getting the update on that audit at our next meeting. I don't necessarily have anything else for new business. So we'll go into comprehensive community services, CCS. As I already stated, we have a new service facilitator that will be starting with us on March 31st. Service facilitators, each of those facilitators are carrying a caseload of approximately 17 to 18 people, which is over the recommendation of 10 to 15 people per caseload. So definitely the replacement hire will lessen that caseload for our service facilitators. We continue to be part of a 9-county consortium. Our administrative staff is within Chippewa County. We operate independently at the county level, but within the consortium, I don't think I have anything. CCS. Does anybody have any questions about comprehensive community services? Okay. Let's go into mobile crisis, statistical value. You have 2 handouts in front of you. One is an ongoing form. We have records back to 2014 on this form. It's a really good snapshot of where we are within the month of the year as far as crisis response. You're going to notice something new on this report. I know that in previous meetings, we always talk about our proactive measures within Rusk County, and that attributing to all of the upfront work we're doing in preventing crisis. But we really never had a good system of capturing what we're doing on a proactive stance. So starting this year, I had Bethany, thank you. I had her kind of go back through all of our initial contacts from the first of the year. February, we might have, or January, we might have missed a few because we just started this right in the beginning of February. So I'm not sure that our numbers are as accurate thus far as they will be going forward, but we really wanted to take the credit for all of the upfront work we're doing in preventing crisis. So on the adult services, the sheet right here, you're going to notice in the first 2 slots, we have mental health referrals, IC, which stands for initial contact, and then AODA referrals, IC, initial contact. So we can capture all of those are going to be referrals that are coming in from ancillary partners in the community, walk-ins, phone calls, anything that we're doing upfront to provide some sort of informal assessment and linkage to services. So I'm excited to see where those numbers go, because I really think that that's going to capture all of the hard work that Bethany and everybody in our department's doing. Jail assessments, jail prevention. For those of you that are new, when we're doing assessments, SMOC situations, those are people in the jail that are at risk and in a safety prevention suit, a Kevlar suit. Prevention is really any referral that I'm doing at the jail. Linkage, again, some of it really falls in the realm of the initial contact. What are the needs? How can I assure that linkage within the jail and upon release from jail? Again, that is a good measure of prevention. Community assessments, those are assessments where our individual mobile crisis staff are presenting somewhere to do a face-to-face full assessment with a consumer. Typically, those are led by law enforcement, and we are doing those assessments either at the law enforcement center or at the hospital. Emergency detentions under our 42 board, that is when we are involuntary placing somebody in an approved hospital for self-harm, harm to others. Sometimes it's AODA related, but essentially it's that 72-hour hold for a psychiatric evaluation and recommendation by the hospital for potential need for commitment. That 72 hours does a lot of things. It offers a psychiatric or professional evaluation, possibly a diagnosis, and then possibly a treatment response that might mean medication. All emergency detentions do not turn into chapters or commitments. It's really done through the recommendation of the physician in a court hearing. 35 transfers are individuals that are already on a county commitment, but they require a more secured setting for whatever reason. And so we have the ability to move to a more restrictive setting for a reevaluation by that psychiatric service. Sometimes that's just for a med adjustment. Sometimes they need a higher level of care. And that 35 transfer gives us the court mechanism to move them to a more restrictive setting. 45s are individuals that are at risk of safety, harm to self or others, but it falls under the realm of individuals that are under the influence. 5115 conversions, that is more so a safety concern where somebody needs hospitalization, but there's a different mechanism driving the safety concerns. And what I mean by that is it's not necessarily a mental health or an AODA concern, but more of a cognitive issue. So the 55 conversion gives us the ability to move that into more of an adult protective service realm that we'll be looking at need for guardianship and things like that. Medication requests for Aurora, I added this space too, and this is essentially per our contracted language with Aurora for our psychiatric service with Dr. Spitsness and his nurse practitioner, Claudia. We have not been tracking that in a formal way. Obviously, we do through our billing process with Aurora, but I thought that that would really fill in some gaps here on our mobile crisis review. OWI, an intoxicated driver program. This is always behind time. You'll notice that, you know, it's already March. It's blank for February, but there's a process that the paperwork has to go through. So those blanks are always filled in a month after the fact. So they're always going to be zero during our current meeting. But they'll be tallied over throughout the years where you can see OWI rates within the county and how many of them are wrapped into some formal programming. Crisis Line is our contracted service through Aurora. We may get that from Northwest Connections, which is not our county contracted services, but all surrounding counties use Northwest Connections. So we're kind of changing our way of tracking that too, because there's still a response needed. So we're opening that number up to Northwest Connections also. So that number might be a little bit higher in the future. And then guardianship and adult protective services. Those are APS cases that came through Brenda's desk. Alicia will now be tracking those through Paradox sheets, and those essentially are the same concept as the initial contacts up above for mental health and AODA referrals. I don't know that I've ever went through all of those specifically, so I hope that that was a little bit helpful. And I really wanted to just hone in on it because of this, the few changes that we're making. Anybody have any questions on that? Talkative group, okay. There's some verbiage underneath the statistical data that just kind of breaks each program apart, which I kind of just did for you. I'm not going to read through that word for word, but feel free to look at that. So every March meeting, we go through end of the year statistics. This is basically the form we just looked over. The next form, the end of the year form, is really just kind of breaking that apart per total assessments. We look at gender, we look at age, we look at recidivism, we look at insurance as far as linkage. We look at where those assessments are done, who we're getting the referral from, whether that's Ladysmith Police Department or Rusk County Sheriff's Department, the hospital. Sometimes those calls are coming from schools. We break that down into daytime calls as opposed to after hours. We keep track of the comped hours that our workers receive. We keep track of the length of assessments. We keep track of how many assessments turn into chapters and what that looks like for law enforcement in their time for transport. What else? And basically, you know, this review is really looking at where can we improve, where are our biggest issues, what are our biggest financial impacts, and looking for ways we can overall improve our whole process within the county. So this is just a breakdown of our year end. Phil, please open those and pass these around, because I'm not taking them home.
Start that way.
There you go.
Then I got time to think about it.
Yeah.
I just got one question, Dawn.
Yes.
On actual hours, it takes longer for nighttime to solve the situation than it does during the day? Or is there another reason?
I think that there's probably several reasons.
Okay.
I think that, you know, the majority of your daytime calls are like to the schools or something like that, where the probability of a community-based safety plan is higher during work time hours. And I think a factor in that is, again, we're always looking at like a no wrong door approach, and what can we do collectively to assist in reducing the crisis experience. And so I think there's a bigger opportunity during daytime hours to say, okay, you're having, you know, emotional issues, crisis situation, but through an assessment, maybe, and I'm just thinking of an example off the top of my head, but maybe it's because they're not on their medications because they decided to not refill their meds and pay their rent this month. So that opens the door to a lot of different approaches to solve that crisis rather than like, holy cow, we're in a crisis mode, we have to go to a hospital. So we can walk them up to our department and we can, look at Aurora for emergent medication administration. We can get economic support involved to look at are they utilizing all of the funding that they're available for state-based services. We can look at energy assistance and say, is there somewhere where we can help with a program to take care of this bill? So again, I just think that we're open to so many more resources that we're able to solve that problem and without doing a crisis. So again, linkage and risk management is what we're doing. When you're after hours, most of those are crisis and without all of the ancillary support at your fingertips, sometimes we can't do anything to minimize that risk. And so I think more of your chapter situations are probably after hours. And of course, then you're doing medical clearance, you're waiting for transport, et cetera. So all of that, accumulates in that time that we're documenting. So that would be my guess without looking case specific, but that's a great question.
Let's just do this.
I mean, anecdotally, like when I was at the hospital, I feel like definitely more of the like self-harms were after hours, There were, I feel like definitely more came in, in the
Yeah.
evenings or late at night.
Yeah.
Than, 10 in the morning.
Yeah. So again, I think that, our staff, when you're looking at mobile crisis assessment, you're really looking at what is the risk assessment and what is your ability to manage that risk. And I always tell my staff that if you're doing a risk assessment on somebody and you have 7 red flags, you better be able to manage 7 things in your safety plan. If you can't manage those, then you're going to be looking at more of the need of a secured setting through hospitalization. Again, goes back to the theory of if, I can manage 6 of those things, but there's one outlier. But if I bring them up to DHHS and get them linked into that immediately, does that manage the risks? And so I agree with both of those statements. Any other questions on that? The only other thing that I'm going to put out there, and I have not seen an agenda yet, but last week at a CJCC meeting, there was a request for an evaluation of crisis within our county, specifically in the realm of individuals that are suffering from mental health and or AODA issues, and how that potentially could turn into a criminal type situation. So really looking at individuals that potentially might be arrested or some sort of citation coming across from a criminal standpoint, and how that reflects on an individual's diagnoses or struggles. There was a feeling that there was a need for an ad hoc team to look at that. And so that team is being developed right now. And there is going to be a meeting, I believe, on the 26th. So I don't have anything else to really report on that right now, other than that that's going to happen. And I believe that, some of the outcomes or thoughts in that meeting are going to be obviously relevant to my department, and something that I may have to bring back to this team and talk about.
Can you give an example? What are they? I don't get. How are you going to determine if they're potentially
I don't know that I would go into too much of
Okay,
that
it
at
does,
this
Yeah,
point in time.
yeah.
okay. I
Um,
just don't-
I think,
That's fine if you guys are still working it all out. I just. am
I
not
would just say that
picking it
there
up.
was a concern that was brought up relative to a couple specific cases and how the individuals had some mental health concerns and how it impacted crisis and the criminal aspect. So I
Okay,
believe the meeting is to kind of talk about both sides and how we can work together to best
mhm,
help the consumers.
mhm.
like look at red flags that might lead to criminal activity down the road.
Well, and I think that that's an interesting statement because that's
Okay.
exactly my concern from behavioral health, is that, you know, anybody that has a mental health diagnosis, whether that's, serious and persistent mental health, like your schizophrenias and your bipolars or whatever, all the way down to depression and anxiety.
Sure.
If you look at the coding definitions for that diagnosis, you're most likely always going to see a symptom that is relative to impulsivity, those type of things.
There's just so many factors that. can
Correct,
determine that.
correct.
How are
And
you gonna
so-
Suss that out. But
So I
I
really,
guess that's a you guys problem.
yeah. So from a behavioral health standpoint, I think that it's really important to for me to acknowledge that individuals that have mental health um, instability versus crisis versus stable is a
Okay.
big difference. And you can't cookie cutter,
Right.
that if there's a criminal act because of a diagnosis, that shouldn't be the number one thing that we look at. So,
Okay.
and it's person specific, right? And so
Right.
how do you make a blanket statement of whatever,
It's just- okay.
Yeah, so I'm really curious. Like I say, I've not seen an agenda, but certainly I think it will be very informative in understanding from everybody's perspective. I think there's going to be a wide variety of professionals on that team, and everybody is going to have great perspective, I would think. So, just coming together cumulatively and trying to figure out. What is the best for our consumer, because obviously that's why we're all here. So, so stay tuned on that. Okay. Let's see. CSP, we currently have, and that's part of this statistical data here. We currently have 16 members within our CSP program. At the beginning of the year, we are starting a new process where that billing is being done in-house, where historically Aurora has done that. Jeremy worked extremely hard with finance to figure that whole process out. So we'll wait for numbers to come through and see how that new process is working. Group home placements are about the same as last quarter reported. We continue to look at, Wisconsin is obviously a least restrictive placement state, so we're always looking at changing needs of our consumers and those in particular that are in placement. We're always looking for, could somebody be more successful in the community with added supports rather than group homes? So these numbers, they don't change very fast, but we're always looking at it and evaluating least restrictive for our consumers that are requiring some sort of placement. Any questions on that? It's kind of all over the place.
Oh,
Yeah.
Adult services.
Yes.
how many, do we just contract with one adult service provider, or are there more, or how's that work?
For placement, you mean?
Not for placement, but to help in their apartment or help in their house or something.
Well, that goes back to the conversation of community support options. So, I think one of the great teams that we have is what we call informally our do-gooders team, where there are probably 15 different community partners that are
So
in
that would
that.
be private businesses that would go in to help, or what?
Not necessarily private businesses. So you have Lighthouse representation on that team. You have members from the FSET committee. You
So-
have
so
members from
where's this
Salvation Army,
Okay, what group is this
the do-gooders team.
Oh.
So we're looking at, again, part of that outpatient linkage to help somebody be as successful in the community as possible. So we typically meet like every 2 weeks, and we're reviewing cases that come in through Salvation Army applications. But in addition to that, it creates a real networking. So like, if we're on that team, I don't have specifically an application, but I know that, in fact, I just did that yesterday. Bethany and I did it. Reached out to a Salvation Army member and said, hey, we're trying to get linkage for this individual for this. Is this something that you're aware? Is there any programming out there to help with that? So that networking is super important for our consumers at whole in our community, to be able to make sure that we're utilizing all resources available.
So how are the fundings coming through Salvation Army?
So it kind of depends.
Yeah.
So what happens is, in this group in particular, is somebody needs assistance with
Yep.
something.
Yep.
The team reviews it and somebody will make a recommendation. I think that this agency can really help this. Maybe we need to connect them with TBRA, or
Yep.
maybe that individual needs to go to Embrace.
Yep.
So everybody's at the table, and whatever is best going to help that person, we direct them to that entity to help them.
Yep.
As for like the actual adult services unit between Chris and now Alicia and
So there's
Bethany.
a couple of members here that belong, or that go to that.
Yeah,
Yeah.
Chris and I are both on that
Yeah.
team.
Okay.
Yeah.
Yep, and then Rich will be on that team as of Monday.
Yeah.
So they are constantly talking with clients and asking like what they need to be successful, and they're doing their research and they're supporting that person to help them, through whatever crisis
Well,
is
that's
going
why I'm
on.
asking. I know there's been a little rough stage for Salvation Army the last few months.
With the coordinator, you mean, like
Yeah.
with, okay,
Yeah, I know that for a fact because I've talked to the guy up in Michigan there, the regional manager.
Mhm. He's on those teams with us too.
Yes.
Yep.
Yes.
Yep.
Okay, so is that getting ironed out a little better, or?
so I guess I don't know what's happening
Yeah.
behind the scenes, but it hasn't affected us meeting and assisting
I
clients.
know there's
That hasn't happened.
some rough waters there a little bit. Because
Well, and if there is, they're hiding it very well because it doesn't come across in the meetings.
Okay.
We
But
haven't
it
had any
hasn't-
issues being
No.
able to
But you're
provide for our
getting your money,
community.
you're getting your referral.
Absolutely. Yep.
What can I call, vouchers, that's what I'm thinking.
Yep. So whatever,
Vouchers have been coming through.
yeah, there hasn't been any
Okay,
issue
okay.
in that regards.
I can, I have his phone number,
Yeah, Kurt
Yeah.
Spicer.
Kurt,
Yep.
I've been talking, not on a monthly basis or anything, but if there's something
Mhm.
that comes through the pipe and they know that I've been involved with Salvation Army for years.
Mhm.
And they give me a buzz or give my wife a call.
Yeah, we haven't encountered
Yeah,
any
no,
issues, so it's been,
Okay.
we have a pretty decent system and a really great team. So
yeah,
Okay,
yeah.
okay. No, yeah, you said who's all on that team?
Gosh,
a bunch of community partners.
yeah.
And did you mention the homeless shelter?
Embrace
Yeah.
The Lighthouse is not on that team.
Well, Aaron was
was,
coming
yeah,
on.
yeah.
Well, Aaron isn't
she's still wrangling the Salvation Army application.
Right,
Yeah.
yeah, but she isn't a part of the lighthouse, so the lighthouse is not on that team.
We can get you guys the
Yeah,
invitation
yeah.
so you can appear on
Okay,
that.
okay, I just wanted to, that's the point I'm getting at.
Well,
okay?
you should have just,
Well, I know, I mean, sometimes you gotta get background information.
And sometimes being so direct doesn't rub people the right way.
no, just say, hey, I'm the director. I would like to be part of that team.
Yep.
I've said it a couple of times to Kurt Spicer, so.
Oh, okay. And typically, I don't know, but Jeremy has been sending out the invites and in charge of that. So could have got lost in translation, but now I'm in charge, so I can make sure that you
But,
Yeah,
get them
absolutely.
an invite.
okay,
yeah.
so your money's coming through for the Salvation.
Yeah,
Okay, so
there
you're
hasn't
going
been
for
any
vouchers.
issues with that.
They're not actually money, it's vouchers.
Correct.
Okay, thank you.
Okay, I guess I don't have much else on my stuff. Let's go to community partners. Keely, anything you want to report from public health?
Well, I mean, we're always trying to improve access to care, so we did get funding, residential, opioid funding, like for people at risk, for room and board, that's what we're looking at, the room and board grant, and from Marshfield Community Grant for the JLA ODA program. That'll help offset some of those costs. And mental health is still an objective on our chip. We're kind of focusing more on like social connectedness, and just, so we're way upstream. I always say that, but just trying to promote community involvement and get people like build those relationships so they have some support nets. I think that's about it for related to you guys.
Yeah, wonderful. Kevin, any updates, law enforcement?
Finally full staffed after 3 years, so.
Good.
So that's gonna help with our transports anyways. So we don't have to contract hopefully with outside agencies to transport, because that was very costly for us. I see we had 7 chapters, and I would suspect that we probably used the transport team for all but maybe 1 or 2 of them.
Okay.
$1,500 a track, so.
Yeah.
So that's all I got.
I know that I can just add as far as training, and we're going to continue to meet, but with the full staffing, and obviously Sheriff's Department's not here, but with the jail staffing, we have talked about revisiting, doing training, mobile crisis in-house, collaborative training again. We last did one last summer. And so I know we've had some changeover in staff, and so I want to get that scheduled again, where we'll have LPD and Sheriff's Department, my mobile crisis team, Corporation Counsel, and jail staff. And we can do jail staff different because that's kind of a different scenario anyways. But I'd like to get that scheduled again. So
Yeah, let me know.
yeah, perfect. Okay, Chris, you have been patiently waiting. Any Inclusa updates?
So yes, I don't have any updates for Inclusa. Unless you have questions.
I don't. I know that
Okay.
we continue to meet with Adult Services does. We had kind of an off rotation meeting right before Brenda left,
Mhm.
just to kind of tie up any loose ends and create that ongoing list of mutual consumers that we have. But we were waiting for Alicia to kind of get on board, and then we'll bring Carla back in and do another meet and greet with her. And we'll obviously invite any of your team members if you want to come to that, just so we can put a face to a name with Alicia in her new position. So I'm letting Alicia get her feet wet a little bit. She's only
Okay.
been doing this for a week and a half. But we'll schedule that and get that going.
Sounds good. And with Brenda, it was emails. We emailed her high frequency.
Are you still there, Chris?
Yes, yes.
Oh, okay, all
Did I,
right.
did I,
Sorry,
did
I
I
was,
cut out? Oh,
yeah, you did.
oh. No, I was just saying that with Brenda, it was, her email. We emailed her a lot.
Yep, yep. And I would encourage you to continue to do that right now. Those messages are coming through to both Alicia and I. So, if she's not available due to training or whatever, we can assure that I'm addressing things in a timely manner with you guys. So,
Okay, sounds good.
yeah, just continue to do the same process and we'll kind of work through all of the training and meetings and going from there. So,
Okay.
okay. That actually brings us to the end of the agenda unless there's any walk-on items.
Can I just ask, how many group home or how many foster homes do you have in West County?
Foster homes or group
For
homes?
kids,
Yeah,
county licensed,
Yeah.
2.
2.
Yep.
Oh, my God.
It's not a lot. That's why we are placing in treatment level homes, and
So treatment level homes, so what?
I don't have that number because we don't license them. Private agencies license treatment homes.
Really? Okay, okay, yeah. Well, see, my wife and I were foster treatment for AODA kids 30 years ago, 25 years ago, or about 30 years ago. I'm just curious. No,
Very low.
really?
It is.
So what kind of placement do we need, or what kind of,
We would love more people to get licensed.
well, yeah, I know. but I
At the
mean,
county level.
Like how many, half a dozen more or so, or?
I would say if we had even 3 more foster homes
Really?
would be awesome. And if
Okay.
those individuals wanted to get licensed for teens, that would be wonderful
Yes.
because everybody wants babies and little
Oh, yes,
kids.
I know,
But
there's a difference.
there is a huge difference. But those teenagers really need
Oh,
a
yeah.
solid foundation,
Yeah,
a
we see
solid
a lot of
home.
them come through shelter lately. It's been pretty hard for regions.
Yeah.
I-
And it's not just in Russ County,
No,
that's like
It's everywhere.
nationwide, yeah.
So just out of curiosity, what does that pay? Is that,
For county,
Yeah.
right? Well, so you get a foster care rate. It depends on the child's age.
Okay.
There's a breakdown of like 0 to 4. You get a set by the state, but then it also is, okay, we're gonna get in the weeds. But the social workers have to do an assessment of the child, and it talks about their needs. And if it's a very high need child, that payment is higher. So
Okay.
I can't give you an exact number because every child is different. The base is the
Actually.
same, but the needs, can bump that.
What
payment a
about
little
like
bit.
youth services, like group homes?
What's like if they're here in Russ County
Is there that much of a need?
is there a group home, or how many group homes are there in West County?
for kids? 0.
Zero.
0.
Our
Yeah.
closest group home is probably an hour away.
Hour and a
Chippewa
half.
Falls,
Yeah.
Rice Lake,
Hayward,
They were,
Ashland,
really?
and they're almost always full
Always
or unwilling to take kiddos that have a higher need. So
Well, we used to be contracted under Family Works. Remember them? Are they still in business? I haven't.
Family Works is still a private agency.
They are. Okay,
Yep.
I mean, we used to be licensed under them.
Yeah.
And we did our work with them.
Yeah, they have homes licensed here in Lady Smith and Russ County.
Oh, they do?
They do.
Do you guys do any work with the coordinated entry or, cause like there's a youth services coalition that we deal with, like the homeless shelter world, right? And they do a lot of, youth services.
So not particularly in our children and family services unit, just because, we don't really, we don't have any, but on our radar, we don't have like the homeless youth that are coming through our load.
Okay.
So we are not actively working. We have a worker that's designated to do like our independent living skills and keep tabs on all the requirements for our youth that are 14 and up.
Mhm.
And the social workers have to be working individually with that kiddo. So we're preparing them if they have to age out, for the real world.
But even with aging out, so they age out at 18, right?
They can
Can,
if
but
they
they can
choose
stay-
to.
Oh, but can they stay? So like in the homeless industry, it's to 24. So youth services go from 16 to 24.
If an individual, like a juvenile, is aging out of the foster care system, they can choose to stay in their foster home after the age of 18 till like, I believe it's 21. Like they can do that. Most kids don't do that. They're
Don't,
like,
right.
I'm out. I'm an
Right.
adult. See you later. But they do have the option. But there is a time frame. So this kiddo goes out into the world, not doing so hot. They can come back. They can contact the county and then get assistance again.
Okay.
So there is a time frame. I'm not very familiar with that just because we haven't had it happen. But there is assistance out there for those situations.
Good information.
Yeah, absolutely.
Any other walk-ons? Okay.
Just as a county board member, I'm fearing the state is now requesting a DEI Trump Musk thing there. All the counties are getting a letter. What are you doing as far as this? So it's just, it's sponsored by two straight Republican senators. So I'm scared what that's gonna turn into now too.
Sure.
So,
You got a letter
every county got a letter.
about like what are we doing?
Do you have anything that affects DEI?
They wanted any like trainings, job descriptions,
Yeah.
funding we'd receive related to that.
Yeah,
Oh, geez.
like they don't have enough to do in Madison
Yeah.
or DC.
Okay, thank you for that add-on, Phil. The only other thing that I want to talk about is the scheduling of our future meetings. So we typically meet 4 times a year. That is March, June, September, and December. Historically, this meeting has always met every third Friday, with the exception of needing to switch things around a little bit according to Phil's schedule. I already kind of briefly talked to Phil before the meeting about ongoing meetings. And really it's with our new format here of streaming the meetings, there's a benefit to schedule our meetings through the rest of the year. Then it's one link. It's the boardroom can be booked that far in advance, and we don't run into complications like we did today, and where we don't have a mechanism for a room that has the audio hookups for the meetings. So my proposal is to schedule the next 3 meetings throughout the end of the year. There's also a proposal that Fridays are not the best days anymore. Historically, it always interferes with my monthly meetings in Dunn County. And so I always miss those on the 4 times a year. And I into the consortium meetings. Additionally, I think it's a little bit more difficult for people to come in on Fridays if they've already got hours in. It creates overtime, lots of issues there. So my proposal would be to not right away Monday morning, because Monday mornings are kind of complicated sometimes, given the weekends. So is there a day or morning or afternoon that we can kind of take a consensus that works best for June, September, and December?
You do one of those like polls?
Like a doodle poll.
A doodle poll? I can probably figure that out. I've never done a doodle. I mean, I've done a doodle poll. I've never set up a doodle
I've
poll.
set them up if you want. I can set one up.
Okay.
If you want you want like just any days offer? I mean, I guess you and I can talk.
Yeah.
And figure out what
Yeah.
kind of days initially and.
Okay. Are we okay to do that? And we can, oh, go ahead, Chris.
I was gonna say for me, Thursdays are not a good day in the morning. I have lots of staffings on Thursdays.
Okay.
And it
Good
would
to know.
really be nice to have like an afternoon meeting, like maybe after lunch. Mornings are really hard because you never know what the morning is gonna bring.
Yeah. Phil already suggested that afternoons might work better for everybody.
Yeah.
And by Monday afternoon, I guess that's not a huge issue. So like if we could, we'll do a doodle poll for like afternoons, Monday through Thursday. And so expect that to come out and then I'll let you guys all know via email the response and then we'll have something set in stone.
So does that ask you what you can do or what you can't do?
It'll say like, here's the options. Does this day work for you? And then there's like an option like yes, if has to be, or no, like not at all.
Okay.
Okay.
And then it'll kind of compile like, okay, most of the group says this day will work for them.
Perfect. Okay. I was just thinking quick about who to send that doodle poll to. One other staffing change that I did not mention, I think you guys are probably all aware, is the sheriff, Phil Grassman's appointment to the sheriff by the governor. I apologize to Phil. I didn't say that within the introduction. So, okay, look for that to be coming out then, and then that'll set our next meeting. And it'll have the
Well,
meeting.
that day of the month will set the rest of the year then.
Yeah,
Like, are you thinking like you still want like the third?
yeah, I
Monday or
think we
third
should
Tuesday or
try and
third
keep
Wednesday?
it consistent.
Yeah,
Like
that's
if,
good.
let's, for example, we pick Tuesday afternoon. It'll be Tuesday afternoon on the second Tuesday of June, September, and
Yeah, I think
December.
that's good. 'Cause,
I think
like, Thursday might
consistency.
work, but not the Thursday of HHS meeting in the morning, or
Right,
I have
Yeah.
one
right.
that meets once a month on
Yeah.
Thursdays, or,
Okay,
there's certain stuff that meets monthly on a certain day.
okay, sounds good. All right, so look for that to come then. And Chris, thanks for joining us.
I want to say something. Thank you all for your patience with me sometimes to where I ask questions and I do get good answers.
Good.
And as my last official move, I like to make a motion we adjourn.
We don't wanna.
I'm going home.
Then we'll go for a second. There's a second.
I second that.
Okay.
Thank you all.
Okay, thank you, Chris.
Thank you. You guys have a good day.
You too. Enjoy the nice weather.
Yes, thanks. Bye.
Bye.